Today we'll be talking about my top 10 must-haves when looking for a psychiatry program. Hey, welcome back everybody. I'm Dr. Jackie. I'm a child and adolescent psychiatrist. I make videos on psychiatry training, mental health topics, as well as how mental illness is portrayed in the media. If that's interesting to you, like and subscribe and join the team. All of these things are important in my opinion. Obviously, that's why they make my top 10 list, but let's talk about my least important and my most important. Starting with number 10, location, location, location. You will be spending a lot of time in the hospital working, and so when you are not in the hospital, enjoying the place where you reside is huge. Depending on what kind of lifestyle you're looking for, you might want to choose a place that has a lot of nature and hiking trails or has easy access to the city. Being close to family and friends might be something that's very important to you as well. Number 9, salary and benefits. This will be very different across the board. However, what I noticed when I was interviewing was that they often change based off of the location. And so the more expensive places to live in often had higher salaries. Although your budget, of course, is set by you, so how affordable places really depends on your spending habits. Another thing to consider would be the benefits, like do they have retirement and do they match your contribution and how long it takes to get those contributions vested. This is particularly important if you are really hoping to match in a program that you hope to build a lifelong career in. Number 8, sick days and conference days. How many sick days are you allowed as a trainee? And how many conference days are they allowing you to have? On top of that, when you do have a conference day, are they truly protected? How difficult is it to get somebody to cover for your shifts or your patients when you are away during conference? Conference days aren't very useful if you aren't able to actually logistically make it happen. A good way to really suss this out during your interviews is asking how many people actually attend the conferences year to year or based on which year in training they're in. That way you can tell whether a program is prioritizing allowing their trainees to attend conferences. Number 7 is the size of the program. This varies greatly across the country, and based off of location, you might have a few trainees versus 10 to 15 per class. This comes with pros and cons, and so making sure if this matters to you at all, asking how many people come and go each year, and if any of them decide to stay in the institution after they graduate. Number 6, this is something that I don't think I have to prompt most people to ask about, but it's the call schedule. How often will you be expected to be on call? What floors will you be managing? How many patients will you be seeing? And what kind of support and guidance and supervision do you have when you're on call? This is really important, as you can imagine that as more frequent or as less supportive a program might be during call experiences, the higher chance that you might burn out, and that's not a good thing. Rotation options is my number 5. For example, if you're interested in child psychiatry, some programs might be able to accommodate you doing pediatrics rotations instead of internal medicine, since the whole goal would be that you're not necessarily treating adults in the long term. Other things that you want to look out for is the quality of your geriatric rotation or neurology, as well as ECT. My number 4 is therapy training. There are so many different kinds of therapy that you could potentially conduct while you're a psychiatrist. I get this question a lot in my comment section about whether you are able to do psychiatry and therapy. If it's something that's meaningful to you, then you can find options where you could work and be able to do therapy as well. Every interaction is therapeutic as a psychiatrist, or at least that's what I like to think. And so knowing these techniques and having an eccentric point of view is important. In combination, when you're doing a psychiatric evaluation and you're recommending a type of therapy, then understanding what these kinds of therapies that you're even recommending is important, even if you're not the one that's carrying it through. You need to know what type of therapy for your patient would be appropriate and most effective, as well as whether they are receiving quality therapy. Number 3 is didactics, or what your curricula would look like. Certain programs will dedicate periods of time throughout the week to lectures that are geared to build your psychiatric knowledge. Training is only a certain amount of years, and then you're off on your own. So really absorbing and being a sponge during training is really important, and you want to make sure that what you are provided to absorb is quality content. You can ask for the didactic schedule, you can ask who will be providing the lectures, and you can also ask whether they're truly protected time. And what I mean by that is when you're in didactics, as well as expected to be on a certain rotation, is somebody covering for you so that you can really truly focus on didactics and that lecture that you're being given. Number 2 is leadership. We talk a lot about that on this channel. Really figuring out what your management style, your leadership style is during training is huge, because during training and after training, you will be expected to lead many teams. And how comfortable you are doing this and leading a team is really based off of experience and other people fostering your development as a leader. So what are the leadership opportunities in that psychiatry residency program? And number 1 is mentorship. If there is somebody that's really valuing your growth as both a person as well as a doctor, I personally think that is the best way to grow. Without the mentorship that I've received, I wouldn't know what actually is possible and the type of experiences I've had, because my mentors have placed me in positions where I really personally didn't think I had any business being in, is the reason why I am able to accomplish the things that I would have never thought I would accomplish. Asking the people that are in that program right now what kind of mentorship they're receiving and or supervision they're receiving on a consistent basis that allows them to feel like they're being pushed into areas of their own personal discomfort so that they can grow. I'm curious what you guys think of my top 10 must-haves. I'm curious if you think that I missed any, or if you would shuffle these all around to all the people that are interviewing or hoping to interview for psychiatry in the future. I wish you the best of luck, and I look forward to your questions and comments. If you haven't already and you'd like to join our team, like and subscribe, hit me up on TikTok or Instagram, and I'll see you at the next video.